the very theme of our institute is to make the life meaningful. That means by the work of plastic surgery, we reform them to the near normal life. Plastic surgery is a very ancient specialty. It dates back to 600 BC when Susruta performed some nose surgery. That surgical work was taken by the Westerners and it has come back as rhinoplasty. That means for 2000 years we have remained incognito mode. We were not visible, both the plastic surgeon as well as their services. Therefore, a necessity has now arisen to project, make us visible. That's how the Plastic Surgery Day started. 15th July of every year has been taken as a Plastic Surgery Day. This is started by our founder, my friend Dr. Sridhar, way back in 2011. This has been continued as a National Plastic Surgery Day from 2011, and suddenly, probably during the COVID time, it has got converted into World Plastic Surgery Day. So this day, Plastic Surgery Day, we dedicate to the patients because they make our lives meaningful by offering free consultation, OP consultation, and some free surgeries. The very purpose of Plastic Surgery Day is to bring an awareness to the general public, to sensitize the primary care physician, and disseminate the knowledge and skill to the junior colleagues, younger plastic surgeons. More so, to organize satellite training and surgical camps, which we have been trying. Thus, in 2013, we started our journey 10 years ago by conducting a 5-day free consultation camp. Next year, we had a screening camp in a remote village, and we had operated 2 people here at the SIMS hospital, the beginning of the hospital, and a CMEP was conducted by nurses. In 2015, we had conducted a major workshop on dental transfer, which benefited about 5 patients and benefited many postgraduate plastic surgeons. Probably that was the first or second workshop in this hospital. And then the National Plastic Day at 2016. Okay. 17, we have made some changes, shown the difference how it should be conducted by conducting a screening camp for the burn survivors, acid burn survivors, for 70 patients examined, screened, and we have done 24 operations in this hospital. And at that time, we had organized a guest lecture. Senior plastic surgeon Professor Nirmala Subramaniam was honored with a lifetime achievement. 2018, we focused on one of the top specialties, subspecialty in plastic surgery, aesthetic plastic surgery. Again, in 2 guest lectures were given by 2 eminent plastic surgeons who were practicing only aesthetic surgery, Dr. Murugesan and Ramchandran. 2019, probably we thought the focus would change towards the health need of the patients. Thus, a full screening of the diabetic foot was organized. I was very thankful to the management of Raju. Probably that was the first time we offered a package of all consultation and lab tests as a well-constructed tariff. It was a wholesome, just like the previous year burn camp, it's a comprehensive camp. And we have initiated a diabetic foot clinic as well as a diabetic foot lab at the year. Then you all know we got paralyzed due to COVID in 20. Same thing with 21 because physical activities are restricted. So we thought that we can advertise or popularize our service through the medium of FM by talking about each and every subspecialty of plastic surgery in Tamil. Then in 22, we are back in celebrating various programs just like free consultations, online queues, then offline queues, poster competitions for staff nurses and doctors to disseminate or to propagate what is plastic surgery. In 23, we are still more organized. Every time we want to concentrate both on the doctors as well as public. Wound care clinic, again, aesthetic gynecology clinic were initiated in that period. The salient feature of that year, 23, last year, was the quiz for nurses as well as a short film competition, which was well attended by more than 6 teams. In 2024, now we are still further standardized. We must have a theme, enhance the quality of life through plastic surgery. And we have actually projected ourselves in the front lobby of this hospital, again thanks to Dr. Raju and the operations. And many events have been conducted. All the participants, almost we have stimulated nearly 100 people. Again, the outstanding feature of this year is the short film competition. This time we went out of SIMS hospital. Nearly 6 teams from the medical colleges, postgraduate plastic surgeons have participated, and more than 16 teams. And this year also we are going to have a guest lecture and lifetime achievement award, and the presence of distinguished judges and prize distribution. And what is holding for the future is we will have to do a lot of peripheral screening, especially in rural areas and surgical camps, then sensitize the younger professionals towards what is plastic surgery. The CMEP's workshop must be a continuous program in our daily day-to-day work. Finally, we have to create a system for this plastic surgery day on July 15th every year. Thank you very much.
Thank you, sir, for that wonderful elucidation of our efforts over the last 10 years. It is indeed a pleasure to see the path that we came through, and it adds a sense of responsibility to do better next year. Now I request Dr. Vishnu Babu, consultant, ICAMS SIMS Hospital, to introduce our chief guest.
Good afternoon, everyone. It gives me immense pleasure to introduce our chief guest of the day, Professor Karthikeyan, MS MCH Plastic Surgeon. I am privileged to consider him my mentor and teacher, from whom I learned the basics of plastic surgery. Professor Karthikeyan graduated from the prestigious Madras Medical College. He completed his MS at Madurai Medical College and MCH at Kilpack Medical College. He is currently the professor and the head of the Department of Hand and Reconstructive Microsurgery at Tamil Nadu Government Multi-Speciality Hospital, Chennai. His journey is marked by a relentless pursuit of academic excellence and surgical skills. His fields of interest include hand and microsurgery and brachial flexor surgery. He is served as an assistant professor at the Institute for Research and Rehabilitation of Hand and Microsurgery at Stanley Medical College Hospital for over 17 years, during which time he guided and mentored numerous aspiring surgeons like myself who look up to him as their role model. He is a very down-to-earth, caring, compassionate and hard-working person. He is renowned for his surgical skill and unwavering commitment to the patient welfare. He has numerous national and international publications and has authored many textbooks. He has organized many national and state conferences and also faculty member of microsurgery at Ethican Institute of Surgical Education. He runs a YouTube channel, GK Hand Surgery, where he has created and uploaded more than 450 educational videos. His channel has over 30,000 subscribers and 2 million views. It is my distinct honor and privilege to welcome you, sir, on this grand occasion of celebration of Plastic Surgery Day. On behalf of SIMS ICAMS, I extend you a warm welcome, sir. Thank you.
Thank you, Vishnu. I request our chief guest, Professor G. Karthikeyan, Professor GK as is belovedly called by his students, to deliver the guest lecture.
எல்லாருக்கும் வணக்கம். அது என்னமோ ஆரம்பிக்கும் போது தமிழ்ல பேசினா ஒரு மாதிரி ஒரு சந்தோஷமா இருக்கு. I'll talk in English, but அப்பப்போ தமிழ்ல போனா please forgive me. And today I wanted to talk about awareness regarding plastic surgery. That is what I'm going to talk about. To start, we always start with this. Yes. We always start with this. Plastic surgery பேசும்போது, why this picture? This is not a religious discourse. This is going to be a scientific presentation. So what are we going to talk about? I'll come to it later. I'm going to talk about the story of a specialty. A wonderful specialty called plastic surgery, but before that, I want to talk about this specialty called plastic surgery. Whenever we say plastic surgery, it is always interesting. And it is all the more interesting for me to come here and talk at this wonderful institution where I shall be talking on the occasion of World Plastic Surgery Day and the culmination of all the events that have led to this particular day. And it is all the more important for me because you have heard of hybrid meetings. Have you heard of hybrid gurus? I had hybrid gurus. This guru was my online guru. And this was my offline guru, Professor R. Krishnamurthy. And I had two roles to play. Under Professor K. Sridhar, I was the Egaladian. And under Professor R. Krishnamurthy, I was Arjun. So, I was lucky enough to have these two wonderful people as my mentors. And it is so very interesting for me to come and talk to you all today about plastic surgery. Whenever we say plastic surgery, everybody says, wow, glamorous specialty. Wow, you're going to be a plastic surgeon. Yes. So, let us first see some people who have had plastic surgery. Plastic surgery, I always believe, not Sushruta, it started with Sridevi. Whenever we talk about plastic surgery, we say, she had plastic surgery. So, what was she like before? Yes. Anybody else? Yeah, you can recognize most of these people. You can recognize them, can't you? Yes. And who else? Wow. This was also a person who was supposed to have had plastic surgery. And then, any more? Yes? So all these people have had plastic, and you have been able to recognize all of them. I'll keep showing you pictures, you should recognize them. Yes. He's also had plastic surgery. Can you recognize him? How come? All along you've been recognizing. So what is this? So the previous picture, you wanted to see how it was before. I showed you the other pictures, how they were before and how they were afterwards. This is the previous picture. Okay, I'll show you one more picture. Let's see if you recognize the person. Anybody? No. We don't know these people. You want to see her before pic? This was how it was. The entire scalp had been avulsed. Now this is confusing. On the one hand, we show wonderful, glamorous actresses. On the other hand, you show normal, ordinary people on the road. Normal people like us. What is this? It's confusing now. Is this plastic surgery? So, let us come to an understanding. When a person has a nose, that nose is a little crooked. That person thinks that nose is crooked and he wants it straightened out. That is cosmetic surgery. The person has a nose, but it has been injured in a childhood accident. That patient wants it corrected, so it is corrective surgery. And finally, this person has no nose tip at all. It was lost in an accident. So now we have to create a nose for him. So this is reconstructive surgery. So plastic surgery is of three types: reconstructive surgery, corrective surgery, and cosmetic surgery. I hope that is clear now what plastic surgery is. It is not just for the actors and actresses. So reconstructive surgery is creating a part, corrective surgery is correcting a part, and cosmetic surgery is beautifying a part. So all parts of the body can be treated in some way with plastic surgery. But if you just think about it, which do you think is more important for our country, for any country for that matter? Reconstructive surgery, because that is what is needing enhancement in the quality of life. That is what we are going to talk about. As Professor Krishnamurthy said, Sushruta, who started this practice of surgery, plastic surgery, 1200 BC. Now, who did he learn medicine under? He is supposed to have learned medicine under Dhanvantri, who is supposed to be the god of medicine. Have any of you visited the temple of Dhanvantri? You know where it is? It is near Balajapet in Vellore, going on the way to Vellore. And it's a very different kind of temple because it never closes. It is like a hospital, the doctor is inside, it never closes. And Dhanvantri was supposed to have taught him. Now, Sushruta Samhita is a wonderful treatise where you have all the surgical procedures and instruments that have been described. But the father of modern plastic surgery is supposed to be Sir Harold Gillis. Now, this person, you can see this patient who's lost his nose and the part of the face in the World War. That is when Dr. Harold Gillis developed the practice of plastic surgery. And what happened finally? Can you see the beautiful nose over there? Beautiful face has been created. But I think you will be able to note it took many procedures. He brought tissue, then he brought bone, then he brought the blood supply, then all this was brought. And you will also note from the first picture to the last picture, the time. You will see he started off as a young man, and by the time reconstruction was over, he was quite an elderly person. It has taken so much of time. That was the beginning of plastic surgery. So reconstructive surgery, recreating a lost part of structure, which could be a skin could be lost or a part of the body could be lost. And when can it be lost? It could be lost in trauma and burns, it could be lost in infections, and it could also be lost following tumor excision. So when skin is lost, we can always replace it. When there is infection like diabetic, this is a very common problem. Diabetic foot is a very common problem. It can be replaced. Skin grafting is a treatment. Whenever you lose skin, that is why plastic surgery is always equated to skin grafting. Lot of skin grafting is done when skin is lost, skin graft is applied. But you can't obviously do a skin graft. So whenever you see a patient with a skin loss, do not think that skin graft is the only answer, because you cannot do a skin graft if the bone is exposed or the tendon is exposed. Now look at this, flap has been taken. If you cannot put a skin graft when bone is exposed or tendon is exposed, you need to put in a flap cover, which is carrying its own blood supply. So this can be done. You can take a flap from nearby or you can take a flap from the opposite leg. Or if the part of the ear is lost. Now this man has lost his ear when he was involved in a fight and somebody bit off the ear. So now the reconstruction has been done by taking skin from the neck and slowly moving it, just like the picture I showed you in the beginning of Harold Gillis. So this is how the ear has been reconstructed, or the nose can be reconstructed like that, or even the eyelid for that matter can be reconstructed. When there is a loss like this is another problem, common problem. People sit in the bus, they keep their hand outside like this. A bus or a lorry comes nearby and takes off their elbow. So this has to be reconstructed. We must remember, you cannot put a skin graft because the bone is exposed. So you need to reconstruct so that he can move his hand. The important thing is not just covering the skin, it must be functional. So this is the flap taken from the abdomen, and is it moving? Yes, he's got a good movement. This is plastic surgery, enhancing the life of people, not only by recreating the part, but also making it move, making it work. Yes, we have seen you. Yes. So we have skin loss like this on the hand. Reconstruction can be done with flaps. Now, the problem comes. I told you when the bone is exposed, you can't put a skin graft. You can take a flap cover from locally or from distally, but look at this defect. It is so large. You can't take any. You can't put a skin graft. You can't take skin from the nearby area. So what do we do? So for this complicated defects like this, you need to take tissue from one part of the body and bring it here totally. No attachment at all. You are bringing it with artery and vein and suturing it here so that it gets back life over here. So this is called microsurgery, reconstructive microsurgery. Reconstructive microsurgery, we have already seen reconstructive surgery. Now we are going into microsurgery. Microsurgery is nothing but surgery using the microscope. So because the tissues are going to be so small, we have to reconstruct the tissues. We'll see what this microsurgery is about. So this surgery using the microscope can be surgery on the nerves or surgery on the blood vessels. So obviously you cannot use the usually available suture materials, you need specialized suture materials. Can you see the suture material here? I'll magnify it to see. Can you see it now? So imagine, this is the level of the suture material which we'll be using, and we'll have to do the anastomosis using this suture material under microscope. So this is very important. And obviously you need special equipment, you need magnification, so we need a microscope. And then we also need specialized instruments. So I'm going into what is this thing called microsurgery and what it does. So you can see the raw area, how we, and the wound I showed you, what are we going to do? So the preparation is done. The flap is taken, we take skin. Now I told you, you cannot cover that area with skin because it's open. The bone is open, the bone is exposed. So we're going to take muscle from the back, put it there, and then put a skin graft. So this is microsurgery using the artery and the vein. So you can see the anastomosis that has been done. The graft has been applied and how it has settled down so that the patient can walk normally on this foot. Now comes a new problem. This young girl studying in the +2, her hand was amputated by her Thai maman because she refused to marry him. So this was brought to us when we were on duty in Government Stanley Hospital, and this hand, amputated hand, was put back. So here you need the skills of microsurgery because you have to anastomose the small vessels and get life going. But remember, I told you, it is not only putting it back, you also need to make it functional. It also has to function. Will it function after that? Let us see.
Okay.
You can see the function occurring. This was done way back in 2003. So it's almost 20 years since it was done. Or you can even amputate parts of the thumb, or even when there is a loss, you can put it back and get back good movements of the hand. So we have different types. Whatever is the type of amputation, we can put it back, provided we are able to find a good blood vessel within that amputated part. So whenever you come across a patient, you can always safely say, please take it, they might put it back, not they will put it back. So we need to see whether the blood vessel is intact, then we can definitely do it. So this is a revascularization. All these procedures can be done. Even a foot can be replanted. Professor Jagan Mohan, my colleague, did this procedure in Stanley Hospital. The toes can be replanted. As I told you, anything can be replanted. As a matter of fact, this is a penis which has been amputated. This patient was a psychiatrically disturbed patient. He amputated his own penis. And we were stupid enough to put it back. And he promptly amputated it after discharge. So that's what happens. Now we come to our example that I showed you in the beginning. This girl. This is a classic example of how reconstructive microsurgery can make a change in life. She was drying her hair. She was in the village, drying her hair behind a machine. And you get hot exhaust air coming out from there. Suddenly it was caught in the machine and it pulls off the entire scalp. So then what happened? It was taken to a hospital. This is actually from Ganga Hospital. It was taken there and it was replanted. And now she is able to wear flowers in her hair. If this part had not been replanted, had not been put back at that particular point of time, she will never have her own hair wherever she goes. She may have to wear a wig, but she'll never have her own hair. So, who do you think she should thank? The surgeon? The hospital? Who should she thank? The person who thought that this particular mass of tissue should be sent to the hospital along with the patient so that they might put it back. If that had not been there, even the greatest microsurgeon could not have done anything. So, it is common people who can do the greatest amount of help for everybody. So, when it is sent to the hospital, how should it be sent? If it is sent correctly preserved, the chances of survival, the chances of success are more. So what do? First clean the part, put it in a plastic bag. A clean plastic bag, seal it completely. Put that sealed plastic bag in a bag of ice. There should be no direct contact between the ice and the amputated part. That's all. This is a simple thing. Wash, put it in a plastic bag, seal it, and then put it in ice. And how much time can you take to put it? Can you put it back after 24 hours? No. It should be usually within 6 hours. It must reach the hospital before 6 hours so that it will have a better chance of survival. So, when you are able to put back an amputated part, can you transfer one part of your body? You have already seen one part. I showed you muscle being transferred from one part of the body to another part and settling there. So can you move other parts? Yes. Skin. This is skin being moved. Now this is bone being moved. And muscle also can be moved. And here you can see composite tissues. Here you can see we are taking the leg, the skin and the bone, and then the bone is taken, it is broken into two cleanly so that the blood supply of the bone is not lost, and that is brought to the injured part, and then the bone, whatever is lost, so whatever is lost can be reconstructed. Very basically, I hope you are all able to understand, any part of the body that is lost can be reconstructed at one go. And that is the beauty of microsurgery. Even in onco reconstruction, where you have reconstruction of the breast or the mandible that is lost due to a tumor, this can also be reconstructed. So, when we talk about microsurgery, reconstructive microsurgery, now, if you look at this patient, this was the hand of a young lawyer whose hand was involved in Folkman's ischemic contracture. You can see that he has almost no movement at the hands, fingers. There is no movement. He came to us asking for, can you do something, doctor? Now, you always have to be very careful when it's a lawyer, you know. You cannot promise anything. So we told him, yes, we will try, but we may not succeed. This is very important. We do everything. As it says in the Bhagavad Gita, you do your best. The result is not decided by you. The result is decided somewhere else. So we did a muscle transfer. Now, when you want to get back movements at the fingers, I told you that you can replace any part. So all you have to do is bring in muscle. So we brought in the gracilis muscle and we anastomosed the artery and nerve so that the blood supply is re-established. And we also coapted the nerve so that it starts acting. So function. So what happened to this patient? Almost complete movements were available. And you can see that muscle that is acting over there. For a patient who has had absolutely no movement for almost 10 years, he started getting back movements and the use of his right hand. So that way, dreaming of bigger things, we can think of the bone, reconstructing the bone in a young boy who had a fracture which was malunited. Now what about this patient? I told you can take tissue from one part of the body and put it somewhere else. So for this patient who has lost the thumb, it's the right thumb also, he needs the thumb to do work. 40% of the hand work is done by the thumb. So what we did was, we did a toe transfer, great second toe transfer. We take the second toe from the foot and bring it here. We anastomose the vessels to bring it back to life, and we also anastomose the nerves and tendons are all done, repaired to bring back movements. So if you look at this patient, he is able to do this work because of reconstructive microsurgery. The magic of reconstructive microsurgery has happened for this patient. This could not have been possible if he did not have that surgery done for him. Now look at this young boy. Electrical burns, he's lost the right thumb, in electrical burns. So what we did was, we wanted to reconstruct. So we measured the bone. How much of bone is required? Now it's like a tailor. You are like an architect. As sir was saying, we are architects. We have to create a thumb now. So you must now measure how much of thumb you require. How much of bone should you take from the toe, from the foot? All that was done. So 6.5 centimeters needed. We have taken the toe, second toe, and it has been taken out. And now here he is with the thumb acting. But I told you, we need to have function. Is this thumb functioning? Let us see. He is writing with that hand. And can you note that handwriting? Don't you think it is better than most of our handwriting? So, it doesn't mean that you need a toe transfer to get this beautiful handwriting. So you can see that the reconstructive microsurgery encompasses everyone. The common man on the road, the child who is going to school, all of them need microsurgery at some point. When the thumb is lost, we can reconstruct with the toe. But what happens when the hand is complete, upper limb is lost, like in this patient? We can give him a prosthesis. But what is the problem with this prosthesis? He does the basic movement with the prosthesis. But what is the biggest problem with the prosthesis? Yes, there is no sensation. Yeah, it's not moving. Can you go to the next slide, Ibrahim? No sensation. This man would like to feel the touch of his son or daughter on his hand. That is ultimate. Giving function is no good. Sir, இந்த கையால என் குழந்தைய தொட முடியல சார். என் குழந்தை தொடும்போது இருக்கிற அந்த சந்தோஷத்தை என்னால அனுபவிக்க முடியல. So what is the answer for him? Is there an answer? There is an answer. Because transplantation of organs began in 1954, beginning with the kidney. And then the other organs, the liver, heart, and the lungs, and all of them came in. But what about hand transplant? The very man sitting here, Professor R. Krishnamurthy, brought this awareness of hand transplant first in India in 2011 when he held a conference on the first Indian hand transplant symposium. That brought awareness. Later, in 2015, the first hand transplant was done in India. And then came to face transplant. Look at this patient. He was mauled by a bear. And what you saw in the previous picture is reconstructive surgery, the usual reconstructive surgery. But obviously that is not enough. People want a better quality of life. Do you think that the first picture, he can go out and show his face to others? Quality of life is most important. You can see the patient after the face transplant. So you can transplant any organ in the body. You just think about it. We all think, we can all imagine. So what are all the organs we can transplant? The uterus can be transplanted. Why should anybody transplant the uterus? No, the lady wants a child. Okay, ask her to adopt a child. Ask her to go in for surrogacy. Will it be the same as bearing her own child in her own uterus? Never. So here comes the role of, when the patient asks for something, the medical profession should be ready to give it. That is the role of the medical profession, especially reconstructive plastic surgery. So that brings us to what else can be transplanted. You can transplant the larynx, you can transplant the knee joint. There may be a day when they'll stop doing total knee replacements. You can get a cadaveric knee and put it there. And that comes to the last part. Can we do a head transplant or body transplant? It's not actually head transplant, it's body transplant. The head is alive, the head is the brain. Can you transplant the body? Yes, you can. It is being thought of now and it's almost come to reality. But we need to remember, in any particular procedure, especially in plastic surgery, India is always in the forefront. In any part of the specialty, so that is the patient. This is the patient who is waiting for a body transplant. So now, yes, I'll show you a picture of the surgeon who has already done this procedure. They are only thinking about it in Russia. It has already been done here. The picture of the surgeon who did the procedure. This is the surgeon who is supposed to have done this procedure, and this is patient. So a head transplant has already been done. It is not a question of whether it was mythology or whether it is stories. People in India have thought about it. The concept they have thought about. That is the most important thing. If I want to build a house, the first thing is the concept that I can build a house. That is most important. That only will lead on to the ultimate reality. And it has already been done in India. YouTube, when I was going on to this, I found out that we need to bear in mind that all the knowledge that we receive today is the work of so many generations of people, surgeons, doctors. It is put into our hands so that we can receive it, honor it, add to it, and hand it over faithfully to the next generation. That is our aim. When your dream is for good, when you have the belief and confidence to follow the right path, the entire universe will come together to make it true, to make it happen. Vanakkam, thank you.
Thank you, sir. Thank you for that wonderful oration. It was enlightening and thought-provoking at the same time. I'm sure you inspired many of our young doctors to think of taking about plastic surgery in the future.